The cost of a life-saving drug costs more now than ever. Insulin is 4 times more expensive than it was 20 years ago. Liam Collins is here in the studio with us with more on this story. Liam?
Yeah, David, you see those prices go up each and every time, and especially too when in an emergency, when you may or may not know you hit the cap for your insurance to cover those costs. The United States Congress could have taken action this week to help with that, but they didn't have the votes.
This is what I've lived with for 37 years. This is what I'll continue to live with till the day I die. And we have to have it.
For most of his life, Kobe Goins has been living with type 1 diabetes. He wears an insulin pump, a constant flow of the blood sugar stabilizing medicine. Even a few hours without it could be deadly.
We need this to live. And it's very troubling to see companies raising the cost on something that is needed to live.
But Goins considers himself lucky because he has insurance and pays only $45 per month, but his insulin need varies, so there are times he runs out. At that point, he may have to pay completely out of pocket.
You are at the mercy of the insurance, because if you run out before that, then you're not going to get any until they give the okay for it.
Ultimately, the patient is the one that is not taken care of appropriately when they can't afford these medications.
Wesley Bradford is a pharmacist at Erlanger Medical Center. He sees every day when the cost of insulin varies from person to person. Some pay $20, the next person in line upwards of $300, so some choose to go days without the medication.
Today they're controlled, they took their insulin. Tomorrow they have nothing on board to control that diabetes, so we're creating complications from that.
The average price of insulin has increased 4 times in the last 20 years. The U.S. Senate tried to get that under control this week, including a $35 cap on insulin for Medicare and Medicaid patients. Tennessee Senator Marcia Blackburn is one of 43 who voted against it.
The bill that they had before us, government price setting is not the way to go. There are other ways to handle this.
For people like Goins, it means even more insulin price roulette.
You know, my advice to people is find a really good pharmacy that you have a good relationship with, that if it ever comes to that, you can reach out to them and they can try to help you out as much as possible.
Now, the entire budget bill, which would have capped insulin costs at $35, also included climate change measures and tax increases on large corporations, but it failed to get the 60 votes that the Senate needed to pass that kind of bill. David?